This idea of flare, that does everyone know this concept of flare? Okay, does anyone not know this? I mean, the idea of flare is that you can be on the drug and then there's some progression of disease. The standard approach from decades of cancer treatment is when someone's progressing on a treatment, you stop that treatment. They're generally experiencing side effects but not enough benefit. What Jared, I think, was speaking to in broad strokes about old rules don't apply, this is a key issue, that the pattern of progression is very different with targeted therapies, that oftentimes people have a 90% shrinkage and then 10 or 20% progression. That should signal that there's still some good being done, some effective inhibition of the cancer by the treatment. And it's not just, you don't want to throw out the baby with the bathwater, that yeah, it's worse than it was 2 months ago or 3 months ago, but if you stop the drug, you may lose all the still net inhibition you're getting, and it's probably better to have partial inhibition than none. And so the flare, and I don't know if you have seen or if there's any data to speak to this, Memorial Sloan Kettering looked at, reported on this in EGFR mutations and inhibitors, and reported that the flare sufficient to lead to hospitalization or even dying was in the range of 20 to 25% in a limited series of patients. I don't think it's that high in my patients, and I don't think it's as high in ALK. It's definitely been reported with ALK. I don't know if you have any sense of proportions of it, but it's something to be aware of, that stopping the drug, even despite progression, could lead to a more rapid progression of disease.
Yeah, I actually see a lot of flare.
Okay.
I actually think I see more flare with ALK, so coming off of Xalkori, than I do even with coming off in EGFR patients coming off Tarceva. I would totally agree. I think one issue that comes up, though, and many of you will be aware of this, is that for clinical trials, they often require that you be off of your prior inhibitor for a period of time. Some of them are 2 weeks. That's a very long time. The flare often happens at day 4, day 5, day 6. So sometimes we don't have a choice. Yeah, sometimes we don't have a choice and we have to be off. So it's a very good thing to be aware of, that there is a chance that during that time that you will have worsening symptoms.
I think that's a message to get out to anybody, that that if you stop the drug, and there are times when I feel like someone who has very florid progression, the drug's just not working anymore. And it's not that everybody absolutely has to stay on these drugs indefinitely, but a lot of people, I think, do benefit from being on something to inhibit that same mechanism. But I try to tell patients who do stop that if the wheels are coming off in days or a week or so, I'll see you and we'll revisit this immediately. And I think that's just a key point to have. It may not be that everybody needs to stay on these drugs forever, but at least to be aware that this could occur, and if it does, you know, waiting week to week could be a 10, 20-pound weight loss, that's breaking a record, I think. But people can become desperately ill in a very short time, and it's maybe too long to just wait until your next 3-week appointment with the doctor.